Happy Friday, everyone. My name is Lori Bambaco. I'm a registered dietitian, and I'm also board certified as a specialist in oncology nutrition. So that uniquely qualifies me to work with individuals who are affected by cancer and all along the continuum of their care. So what I've been asked to do is to take 6 weeks to present to everyone a common question that someone who has been diagnosed with kidney cancer might ask someone like me. And so every Friday, same time, same place, I'm here to present a common question, but more importantly, present some simple yet effective solutions so that you all can learn some ideas so that you can thrive through the nourishing potential of your food choices. Now, each week I'm going to present a question that I think is important for you to consider. Of course, you can drop some questions in our chat and ask away. Let me know what else you have in mind so that I can help address some of your concerns. Now, the information I present each week is just that, information. So if you have a specific concern about your nutrition needs, or you find that you're not eating the way that you would like to, please consult with your medical team. They know you best, and really ultimately, my advice is just that. It's never meant to replace the advice or the recommendations that your medical team would provide for you. Now, why are we here to speak about nutrition? What is so important about nutrition? Did you know that nutrition has a role in every single step of the cancer care continuum? So we know that there are compounds specifically found in some of our food choices that help protect our body from the carcinogenic process. So that means not only the start, the initiation of cancer, but also the promotion and the progression of cancer. So really, nutrition and nutritious choices have a role in every single step of the care continuum. We know that some of the compounds in our foods act like antioxidants. And so what they do is they help repair damaged cells that might otherwise turn into a cancer cell. We know that there are some compounds that are anti-inflammatory, very important for most of us. And we know that some compounds stimulate or rev up detoxification enzymes. And so what that does is it helps us sort of clean up the stuff that doesn't belong in our body that we're exposed to regularly. We also know that during treatment, nutrition has a vital role. So during treatment, if someone doesn't feel like eating, they may not eat enough, and they may subsequently lose weight, or even worse, become malnourished. And malnutrition adversely affects outcomes. So we find that people who are malnourished may not feel as well, they may not tolerate their treatment as well, and subsequently the treatment may not work as well. We also see reduced quality of life for those who are malnourished. So an oncology dietitian, like myself, we can help identify if someone is malnourished or if they're at risk for malnutrition, and create and tailor a very specific nutrition care plan in order to help that individual either reverse malnutrition or minimize the risk of becoming malnourished. And lastly, an oncology dietitian like me, we love to work with individuals after treatment. So maybe they've finished their definitive treatment and they're looking to just pursue a healthy lifestyle. Well, we certainly know that there are some choices, again, according to the individual's specific needs, that matter and that can help an individual really recover from their treatment and pursue the life that they would like to live. So now let's go to the question at hand. Last week, if you recall, I presented the question, what do I do if I don't feel like eating? A really important question to answer. And that's why we started this 6-week series with that one. Now today, I'd like to talk about what do we do if we're suffering from digestive issues. So 2 things come to mind. What if I have diarrhea? what if I have constipation? And believe it or not, these are common concerns that individuals who are diagnosed or on treatment, or again, recovering from their treatment. I speak about this very often with individuals, and we work to, again, tailor a plan that's specific for that individual, because keep in mind, nutrition advice is not cookie cutter. You are special, and you deserve a plan that's just as special as you are. So let's start first with diarrhea. Diarrhea is essentially defined as having soft, loose, or watery frequent stools. And if you are finding that you have more than 6 loose or watery stools per day, please consult with your medical care team. You may need to be evaluated and may require a nutrition intervention. Now, diarrhea can be the result of several different causes, and ultimately the remedy will integrate the medical intervention as well as the appropriate diet intervention or nutrition care plan. So the causes are, as I mentioned, numerous. It could be an infection. It could be related to the treatment. It also could be related to something like an intolerance, like a lactose intolerance, let's say. Or it could be a combination of those things. So again, we need to kind of be detective and figure out what is causing that diarrhea so that we can figure out the best ultimate remedy. Now, across the board, regardless of the type of diarrhea that somebody might be having or what the cause of the diarrhea might be, we do know that there are some specific things to consider in order for someone to stay as nourished as possible. I would say the first step is to think about what is easy for the gut. And what's easy for the gut is just a little bit at a time. So we recommend small, frequent meals and specific choices that I'll get into next. Small, frequent meals that are easy for the gut to handle. And we recommend a routine for this because essentially we can learn to condition our gut so that it can handle the nourishing food that we're providing to it. Now, an interesting point I want to make is that you can let gravity help you. So after eating, if you wait about 30 minutes and lie down, that actually may reduce the transit time or how fast your stools may move through your system. So think about that as using that as a great concept to just lie down after eating and wait about 30 minutes after you finish to lie down. So now, what about specific food choices? What should you eat if you're struggling with diarrhea? Well, we're really going to revert to some bland choices, but also some specific choices that have a special type of fiber that we call pectin. So pectin has been shown to help slow down our transit time. So if we have diarrhea, we have a rapid transit time. Things are moving through quickly. And we want to slow that down. We want to kind of pump the brakes a little bit. And pectin is a great tip, a great tool to help you do that. Pectin also helps to bulk up or firm a loose stool. So if you're finding you're especially loose or watery, pectin is the answer. Now you're asking me, the dietitian, what foods have pectin? I'm going to start with some great ideas right off the bat. And I have my handy dandy little showcase here. So you might be surprised, but applesauce, very high in pectin. So some of the individuals I work with, they may have a little bit of applesauce with whatever they're eating. And it helps to kind of soften, the food in their gut and slow things down as well as firm up their stool. Oats are also high in this special type of fiber to slow down the gut. Now, I have this big old-fashioned oats container in the pantry here because it's such a versatile ingredient. You may wish to use something like a spice or coffee grinder to chop these big old oats up into smaller bits because your gut may tolerate that just a little bit better. Now, other forms of pectin in food, we find very ripe bananas are high in pectin, as well as white rice. So white rice, you can even make this amazing recipe using white rice. It's called rice congee. Have you heard about it? It's a great one. So you take simply a cup of rice, but you're going to double or even triple the amount of cooking liquid and double or triple the amount of time that you cook that rice in. So I would say about a cup of long grain white rice to 6 cups of liquid. So you get to decide. You can either use water or you can use something that's going to give you a little more nutrition, like bone broth or chicken broth or even vegetable broth. And you're going to cook that for a good 40 minutes. And what that does is sort of do double duty. So you're going to help to hydrate yourself because you can literally sip off the cooking liquid, and you're also going to enjoy that rice, which is great for the gut, great for diarrhea. Other choices that are recommended when you have diarrhea are things like peeled potatoes, plain crackers, or even just baked chicken. And again, I could work with an individual one-on-one to see what they can ultimately tolerate best. Now, the most important tip I gotta mention as it relates to diarrhea is to make sure that you are staying hydrated. So vital, because if you become dehydrated, that could certainly bring you to the emergency room or have you admitted to the hospital. That's a critical need, right? So hydration. What's best is water. So we recommend room temperature or even lukewarm water. It's easier for the gut to handle. So avoid those extremes in temperatures. Nothing too hot, nothing too cold for your gut. We also recommend that if you are using replacement drinks like an electrolyte drink or like a sports drink, which are very popular, very common on the market, we might want to reevaluate that decision because some of those beverages are very high in added sugar, and that's not so easy for the gut to manage. And some of them also, the diet versions of those products, like a lower sugar version of a sport drink, they use something called sugar alcohols. And those sugar alcohols also can create some distress in the gut and can cause diarrhea. So sometimes what we do is we might recommend a homemade electrolyte drink, or we might take a commercial sports drink and dilute it with water, but then also add a little bit more salt to that mix. And it just so happens to be the perfect kind of combination that's gut friendly and will help that individual stay hydrated. A good rule of thumb is that if you are struggling with diarrhea, for every loose bowel movement that you have, you should have an additional 1 cup of water to replace what you just lost in your loose bowel movement. And that's in addition to what your hydration needs are for baseline already. And again, an oncology dietitian can help you understand what your baseline needs are. Okay, so now let's talk about constipation. So constipation happens when you are unable to have a bowel movement, or you have to strain, or you're having a lot less of those bowel movements. Technically, we define constipation as not having a bowel movement within 3 days. So again, we want to discuss with the medical team what are the causes of constipation, because just like diarrhea, there could be multiple causes. And ultimately, the remedy for the constipation will be figuring out what that cause is. Some of the causes of constipation could be from prescriptions, right? So pain medications kind of top that list, but also too, some treatments can be constipating. And then did you know that some dietary supplements can be constipating? So sometimes we need our patients to take a calcium or an iron supplement, and those two are sort of notorious for causing some constipation issues. And we just want to make sure the right remedy is in place to help manage that. So what should we do as it relates to some simple, effective tips for constipation? Well, just like I suggested for diarrhea, we want to establish a routine for constipation. So we want to try to eat on a schedule. So trying to eat the same time most days of the week. And you also might want to think about routine in terms of your going to the bathroom. So at 10 o'clock every day, should you just sit on the toilet for about 10 or 15 minutes? It's an interesting phenomenon. We can sort of condition and train our gut to know that, hey, it's time to have a bowel movement. We also want to consider some additional nourishing choices, right? So let's go back to fluids. So fluids are so important for constipation. If you are constipated, we want to increase the amount of fluids that you're taking, and it may be uncomfortable for you, so we want to choose the right types of fluids. So actually warm fluids, so things like warm water with some lemon juice, great way to start your morning if you're working to have a regular bowel movement. Or a cup of diluted tea or diluted coffee, great way to introduce some warm fluids into your system. And what that does is it sort of says, hey, wake up, we need you to have a bowel movement here. and that consistently can make a big difference. We also, once you are having regular bowel movements, we want you to gradually add some more fiber. So most of us, let me just point out, most of us do not eat enough fiber. So we want to go low and go slow. So we don't want to eat a lot of fiber all at once, go kind of 0 to 60. That's actually going to be distressing for constipation. That's going to cause more bloating and more gas and really uncomfortable. So we want to incrementally add fiber where we can find some opportunities. One of my favorite suggestions for high fiber choices to add to your diet is in our flaxseed. So I don't know if you see this big bag. I get economy sizes here. So we go through flaxseed a lot because it's a great versatile ingredient for so many reasons across the board, but especially for constipation. I have this milled flax, but you can also buy whole flaxseed. And I want you to keep it in the fridge or even the freezer because the oils in this flaxseed tend to go rancid rather quickly. So if they're exposed to extreme temperatures or some sunlight, it can convert the oils, the healthy oils that are in this, and it can oxidize those oils. So we don't want to introduce that to our body if we can help it. So I keep this in the fridge here, and I just bought this actually a month ago. So we're getting close to almost a third of the way done. I'm going to have to find ways to use it. But I wanted to just show you a little dish of this milled flaxseed. And it's so mild when it's milled like this that it's an easy thing to add. So if you're having something like a bowl of oats or cold cereal, you can easily just sprinkle this into that. Maybe you have yogurt or a smoothie that could be added as well to those choices. But even on top of a salad or a grain or a bean dish, that flaxseed's really super stellar. It has a lot of fiber, healthy fats, but it also has been shown to help promote bowel movements. Other high fiber choices are also some fresh and dried fruit. I mean, fruit is great. What a great package for us, right? Cancer fighters, but also high in fiber. So all fruits are good fruits for you to consider. Dried fruit especially, so things like prunes or plums or dates. I have a patient who is eating prunes regularly to help him go, and using them in recipes as well. You could chop up some prunes and put that into your bowl of oats. Really great way to enhance the nutrition of that dish, but give you some targeted nutrients that help you stay regular. Also, too, look for some high fiber choices with your whole grains. So things like cereals like shredded wheat or bran. You want to look at your label. And what we're looking for is per serving for that choice to have at least 5 grams of fiber. That's a great source of fiber. So just follow that simple template and you'll be finding you can add more fiber to your diet. Every time you add more fiber to the diet, please consider adding more fluids because your gut is not used to all this fiber. We want to help manage that extra fiber with some fluids. So there you have it. Those are some examples of how you can find some nourishing solutions to some common concerns that you might have for either diarrhea or constipation. Thank you for joining. And at this time, if anyone has any questions or any other chats in the chat box, I'd be happy to address them. Okay, everyone, thank you so much for watching. Happy Friday. Have a wonderful weekend. Stay moving, stay hydrated, and I will see you same time, same place next week. Thank you.